Hi, I'm Bryant Stewart, and today I will be providing a demonstration on phlebotomy. Following this demonstration, MLS students should be able to 1. Positively identify a patient prior to venipuncture, and 2. Be able to demonstrate how to properly perform venipuncture on a patient. Before you approach your patient, you always want to make sure to wash your hands thoroughly and apply a new pair of gloves. Make sure that you apply a new pair of gloves in between each patient. You also want to make sure to wear proper eyewear. Also, before going in to see the patient, I just want to make sure that we have all of our information on the requisition: the patient name, the ordering physician, and the provider, and that our labels also match this information. So we can see the MRN is matching 822-57636, date of birth as well, and the name. Alright, so it looks like we are good to go and see our patient. I also just want to remember these few things before I go and see the patient. Just remember to smile. This isn't always the funnest experience, getting poked, and smiling and being friendly and courteous is something that might help relieve their stress. I want to make sure to introduce myself and have the patient state his or her full name. It's also appropriate to have them spell their name and have them give you a second identifier. That can be dependent upon the hospital, what that second identifier might be. Appropriate ones are a date of birth or the last 4 of a social security number. And also make sure, as we had done over here, that the requisition, patient info, and the labels match. Once we've done this and positively identified the patient, we can then explain the procedure to them before performing the procedure. Also, I want to add some do nots. When you come in to see the patient, you do not want to say, "Are you John?" or "Are you Sally?" Implying that, understanding that they might say yes or no, depending upon how focused they are at that time. That's a way to introduce errors into our patient identification. Also, don't forget to introduce yourself and to be kind and courteous. Hi, how are you doing today?
I'm good, how are you?
Good, I'm Bryant. I will be your phlebotomist. Will you spell your name and state your date of birth for me?
ADRIANASTEWART 12/1/94.
Thank you. Alright, so we're just going to draw 1 vial of blood today. That's what the doctor has requested. Do you have an arm that you prefer to be drawn on?
My right arm.
Okay. So always remember to ask the patient which arm they prefer to be drawn on. Some patients won't have a preference, and that's okay, but it's always a courtesy to ask. Okay. And now I have all of my supplies right here. I have the tube of blood, alcohol wipes, needle, which is an artificial needle, not a legitimate one right now, and gauze. Okay. Alright, so I'm going to apply the tourniquet approximately 2 to 3 inches above the planned venipuncture site. Okay. And when I tuck the tourniquet, I want to make sure that I can remove that tuck with one hand. The opposite hand that I will be holding the needle with. Okay, and now I'll palpate for the vein. I want to make sure you can find a good one, typically one that's straight. So that one looks good. And now I'm going to remove the tourniquet. It's always a safe call to make sure that the tourniquet isn't on for too long. If it's on for more than 1 to 2 minutes, that's too long. This ensures that the patient stays comfortable and also to avoid changing any test results that might vary with the tourniquet being on too long. Okay, and now I'm going to clean the area. Okay. When you clean the area, you want to use an alcohol pad. You apply the pad directly to where you're going to stick. And then you can move outward in circles away from that venipuncture site to make a circumference of about 2 to 3 inches. Performing it this way ensures that the bacteria that might be in that area are moved outward rather than moved back and forth onto that same venipuncture site. This ensures the best mode for an antiseptic technique prior to phlebotomy. Okay, now that we've cleaned the area and we've identified where the vein is, I'll then reapply the tourniquet. Now, if we were using a legitimate needle, there would be a cap, a safety cap, that I would then remove. I now want to anchor below the vein to ensure that it doesn't roll while I place the needle. When you hold the needle, you want a finger underneath the needle so that you can ensure the proper angle. An appropriate angle is about 2 to 3 or 20 to 25 degrees. Okay. Now that I've angled it, I want to make sure before I stick the patient that the bevel is facing upward or toward me. Okay. And now I can stick and apply the tube into the tube hub to make sure it draws. Once I've drawn the appropriate amount of blood, I can then first remove the tube, apply gauze to the area, and have the patient hold this. Will you please hold that right there? Thank you. Now you can remove the tourniquet and remove the needle. All right. And make sure that you then replace the safety cap on the needle by pressing it against the table rather than your finger to avoid a finger stick. The needle will then go into the sharps container. Now, you want to make sure that your blood is inverted appropriately so that the any substance in there can be mixed well with the blood. Okay. And now you can tape the patient arm. Okay. Is that feeling all right?
Mm-hmm.
All right. Well, great. Okay, and you should receive a call back from the doctor's office in about 2 to 3 days with those test results.
Great, thank you.
Have a good day. All right, and hopefully this was helpful in explaining how to positively identify a patient as well as the proper procedure for phlebotomy. Thanks.